Hi everyone, my name is Ashante Everhart, and today we'll be discussing scope and standards of healthcare informatics for administrative practices. The scope and standards of a practice describes the service that a qualified health professional is deemed competent to perform and permitted to undertake. Standards of practice provide a guide to knowledge, skills, judgment, attitudes that are needed to practice safely. In healthcare informatics, it encompasses the use of computer information sciences to benefit and advance the healthcare industry, public health, and individual patient care. Healthcare and administrative practices, also known as healthcare administration, is defined as the management of all the non-clinical functions involved in operating a healthcare facility, from day-to-day operations to staffing, budgeting, financing, to long-term strategic planning to ensure the success of the healthcare provider and the healthcare system. When defining the scope and standards of a practice, you get to define the who, the what, the where, when, why, how of the practice. When determining the standards of the practice, a company must define who must abide by these standards. In this particular case, the who is the administrators, the people behind the desk, the financial advisors, the healthcare administrators, the managers, the secretaries. Those are the who in the scope of informatics for administrative practices. With healthcare informatics, there's electronic health records. With the advancements of science and the development of technology, computerized programs such as electronic health records, also known as EHRs, have been created. According to Hebda and Cesar, to be useful data and information must be available when needed, to whom it is needed, and in the form that it can be analyzed or used. And in this case, EHR allows that to happen. In 2009, the Obama administration signed a law, the American Recovery and Reinvestment Act, which included the Health Information Technology for Economic Clinical Act, the HITECH. HITECH formulated the meaningful use under the Centers of Medicare and Medicaid Services. This made sure that providers were using their electronic health record systems, and when they demonstrated that they were using it, they were rewarded. Because the healthcare industry is growing and the expansion of services and the increase of need for healthcare practices to develop and utilize systems such as EHR, there needs to be people other than the clinicians or the nurses to maintain these systems. And through electronic systems, though electronic organizations have these systems, because there's somebody that needs to maintain this information and organize this information, there needs to be personnel who specialize in performing these technological applications. Depending on the size of the healthcare system, healthcare administration may involve several teams working together to maintain the system at every level. That includes the entire health system for some management teams. Sometimes it is specific to physician practices, hospitals, or home health agencies. Sometimes it could be in a large facility and could be separated by units such as the critical care team working with the emergency department or working in the emergency department. Or sometimes it's specific to clinical areas such as nursing, the pharmacy, or physical therapy. And then also in areas such as staffing, facility administrations, admissions, and finances. The roles of the healthcare administrations include human resource management, financial management, cost accounting, data collection, analysis, strategic planning, and marketing. Maintenance functions in the organizations, providing the most basic social services as well, the care of dependent people, and maintaining the moral and social order of healthcare organizations, and serving as a patient advocate is some of the duties that healthcare providers use in the administrative settings. There are different types of healthcare informatics. So there are different types of systems that could be used in administrative practices. That includes medical informatics, clinical informatics, pharmacy informatics, biomedical informatics, and bioinformatics. To ensure that the healthcare informatics is benefiting you want to make sure that the information is shareable, that it educates the patient, that it includes patient participation, that the treatment coordination, that there's it allows for fewer, which allows for fewer mistakes, improved outcomes, and lowers costs. The purpose and benefits of healthcare informatics aligns. Healthcare professionals need to ensure that they are utilizing informatics to aid their work in time management. Using healthcare systems to record, share data is not where it stops. You also do that by communicating with your staff and your clients via technology such as phone, fax, email, and pagers, which are important. There are other systems and technologies that are being developed, such as an artificial intelligence program called ADA, which is a medical record mining tool set to enhance the clinicians and healthcare management professionals teams experience. With doing so, ADA, a cognitively intelligent text, audio, and video processing engine, would assist with medical coding, ICD-10 procedure codes, determining medical necessity, making sure that the care team gets recommendations for care management and treatment options. All in all, administrative practices, scope and standards via healthcare informatics purpose is to make sure that the client is safe, their employees' information is safe. Is to make sure information is readily available when needed, and is accessed by people that are professionals that are purposely supposed to use it, or clients that are supposed to have a hold of it. It's also by communicating with the care team via other clinicians. In this case, the administrative team speaking with clinicians, speaking with pharmacies, speaking with nurses. So that's pretty much all with the scope and the standards of healthcare informatics and administrative practices. I thank you so much. Take care.